Do your teeth hurt? Well, joining us today from Simpson Dental, we have Dr. Kristen Simpson, and we're talking about root canals, and that can cause a lot of pain. Tell us about them.
Right. Yeah, when you hear the word root canal, a lot of people just tense up automatically because you think it's gonna hurt to have it done. But actually, there are lots of ways to keep patients comfortable and have this procedure go well. You know, normally you only hear about the ones that don't go well, but over 15 million are done per year, and a lot of them go really well. So we'll go over kind of what's involved with the root canal procedure and some of the treatment options just to kind of help you be aware of what to expect if you are to need a root canal.
Oh, good.
So what is the actual root canal? That's the inside part of the tooth. It's the soft tissue part that has the nerve and the blood supply. So a lot of times if there's a cavity or inflammation or infection in that part of the tooth is when the treatment's needed.
And then the procedure that your dentist says, okay, we need to do something here. Kind of walk us through this.
So the actual root canal procedure is where that soft tissue part on the inside of the tooth is cleaned out, because that's normally where the infection is. So you clean out all that infection, put in a filling material that seals that part of the tooth up and restores it back to its natural function there.
Oh, okay. And who typically needs this actual procedure? When is a root canal needed?
Right, so a root canal is needed whenever the infection gets into that soft tissue part of the tooth. So when the tooth is infected or abscessed is when you would need it treated with a root canal to be able to restore it.
Okay, so what happens if someone decides, oh, I don't need to get this done? If it's left untreated, how serious can this get?
It can get pretty serious because that infection can spread. So, I mean, once it's in your mouth's connected to the rest of your body. So that infection can get in your bloodstream and cause a lot of overall health things to happen. So you don't want to wait and let that infection get worse, because that's when you end up with those bad experiences with root canals, where it's harder to get numb, harder to treat when that infection gets worse.
Oh, yeah. Do you think a lot of people they're worried it's going to hurt, and that's why they just don't want to do it?
That's definitely what happens, but with all the advances in dentistry today, we're able to keep patients comfortable while they have this procedure done. You know, we have so many different tools and techniques to help with the numbing, to help the procedure go more quickly, and to have a better outcome for our patients. So it can be done and keep you comfortable.
Well, that sounds good. But are there any alternative treatments available?
Yes, well, so once a tooth is abscessed, really the only way to get rid of that abscess is to treat the source of it, which is the tooth. So either treating it with a root canal or taking the tooth out. And then once that tooth is out, you know, the best tooth replacement is an implant in that spot. You might need to wait some time for things to heal once the tooth is out. It just depends on the shape of the bone.
Oh, okay. And you mentioned you would put a replacement in. Does that tooth need a crown to protect it?
It does. So once a tooth has been treated with a root canal, it needs the protection of a crown. The tooth is a little bit weaker, you know, without that inside soft tissue part of it. So it needs that crown that caps the tooth, supports the tooth, and keeps it stable. A lot of times if people skip that step, that tooth will end up fracturing, and then you end up losing it. So, you know, to complete the process of having a root canal done, you need the crown on the tooth.
Okay, is there anything we can do to just prevent even getting to this step where we would even need a root canal? What type of things should we be doing and can we be doing at home?
Well, that's definitely the best way to go, is focusing on prevention. Prevention is key. So catching those cavities early when the cavity is just right in the enamel and you only need a filling is a better way to go. You know, if you keep waiting until that cavity spreads into middle of the tooth is when you end up needing the more extensive treatments. So like Benjamin Franklin said, an ounce of prevention is worth a pound of cure. So catching things early is the key.
Definitely. That's a great reminder. Dr. Simpson, thanks so much for sharing this with us.
Yes. Thanks for having me.